I just want to focus on a few numbers that you can take back to your offices. Because I think one thing that gets missed in the political discussion, and obviously there's a long political discussion going on right now about drug pricing and about healthcare costs, is that at root, there is a value, and a value that voters share across parties when it comes to medical innovation. And I won't go through all of the numbers here, but I want to leave you with a couple of thoughts. The first is, when we talk about healthcare today, we tend to talk about the problems. We tend to talk about skyrocketing costs. We tend to talk about prescription drug costs. We tend to talk about high-profile problems, and certainly that's worth talking about. But I will go on to say that in our poll that we did, we asked people about the importance of medical discovery. That is, how important is it to you that the US continue to develop medical discoveries that provide treatments and cures for diseases? Now, in this divided world, we found 86% saying that it is very important that we search for these cures and treatments. It's true across party, 89% very important among Democrats, 83% important among Republicans. And one of the things that I've been trying to share in various panels that I've been talking about is this is actually pure stump speech material. That in the end, no matter what we do, no matter how we solve the problems that people face around costs, no matter how we address issues around funding, that the root belief, the root value around innovation is incredibly powerful. It's something that gets head nods, right? I mean, even discussing EpiPen, the most valuable thing is to take the step back and talk about what is going on in this discussion, why is it such an important discussion? It is because of, in this case not innovation, but because of the value of the treatment and the way in which children with allergies' lives have been changed for the better because of treatments like that. Now, of course, that's not a rare disease, and there are much better examples of more significant advances in both rare diseases and cancer, HIV, and Hep C, let alone many other diseases that we can point to. But the fact that we have this kind of innovation is something people value not just for themselves, but for their country. So just as an example, people agree that it'll improve the overall quality of healthcare, help us maintain our competitive edge in science, and can boost American productivity, right? So it's not just about healthcare, it's about the economy. It's about our international edge. And in fact, when we talk to folks in focus groups, people recognize that medical innovation is one of our most amazing exports, right? It's interesting that we had a movie example before, but that's another example of one of the last pure American dominant industries. And when we think about medical innovation, that's an incredibly powerful story to talk about Made in America, to talk about our leadership, to talk about our leadership not just in science, but in doing the things that change people's lives. And then we ask, regardless of who wins the presidential election, do you think the policies will that will foster the development of new treatments should be part of a 100-day agenda? And again, across party, nearly 2/3 and more than 2/3 among Democrats say that it should be a top priority. It should be something for the first 100 days. And then one other thing that I wanted to point out, which again I think speaks to, if you will, the stump speech part of this, is that people don't believe that any one of the, if you will, 3 parts of the triangle that help to bring innovation to market are solely responsible for it. And most importantly, they want them to work together. They believe that it comes from the private sector, they believe it comes from academia, and they also believe it comes from the government. And that's true across party. So that's to say that it's not just a pro-America issue, it's a matter of collaboration. And I do think that when we have these discussions on the Hill, when we have these discussions among the various players, that there's a lot of, well, we do this and those other folks don't, or, you know, we're the ones who come up with the discoveries, they just take it and make a lot of money. I'm not, maybe names here. But that's not what people want to hear about. People want to hear about the end result. They want to hear about collaboration. And they also want to hear about the goal. They want to hear about the North Star. So as you go back to your offices and think a little bit about what we've discussed here today, and you also think about all of the noise that's out there, this week about EpiPen, a few months ago about Martin Shkreli and characters like that, just remember that in the end, this is just the sort of choppy water at the top of something that's a very deep and fundamental issue that affects people's lives on a daily basis, and that they think about quite a bit. So I will stop there, and thank you very much.